All right, today we're going to crack open the user's guide to a medication that's been a real game changer for bone health, Alendronate. We're going to dive into what it is, how it works its magic inside your body, and, most importantly, the absolute must-know rules for using it safely to get the best possible results. Let's get right into it.
So here's our game plan. First, we'll look at the constant battle happening inside your bones. Then we'll see how Alendronate steps in to halt bone loss. After that, we'll cover the 6 unbreakable rules for taking it. We'll weigh the risks, and finally, we'll talk about the long-term strategy.
Okay, so to really get how this drug works, we first have to understand the problem, right? We need to zoom in on what's happening inside our bones. Every single day, it's this hidden but constant process called bone remodeling. I want you to think of your bones as a never-ending construction project. You've got 2 teams working around the clock. On one side, you have the osteoclasts. They're your demolition crew, busy clearing out old, tired bone. And on the other side, you have the osteoblasts. That's your construction crew, laying down fresh, strong, new bone. Now, in a healthy system, these 2 crews work in perfect harmony.
So what exactly is osteoporosis? Well, it's what happens when things go haywire on that construction site. The demolition crew, the osteoclasts, they go into overdrive. They start tearing down bone way faster than the construction crew can possibly keep up. And the result? Your bones become weaker, more porous, and a whole lot easier to fracture. All right, so how do you step in and fix this? How do you restore the balance? Well, that's where Alendronate comes into the picture. It's basically designed to walk onto that chaotic construction site and put a leash on that out-of-control demolition crew. Let's see how it does that. So Alendronate belongs to a class of drugs called bisphosphonates. You can think of them as highly specialized site managers for your bones. Their one and only job is to go to the osteoclasts, that demolition crew, and tell them to just slow down. They don't bother the builders at all. They just focus on reining in the demolition.
So you might be wondering, how does it know where to go? The way it works is actually pretty brilliant. The drug is naturally attracted to bone minerals, so it zips right to the areas where that demolition crew is most active. Then, as the osteoclasts are doing their thing, breaking down bone, they basically eat the alendronate by accident. Once it's inside, the drug just gums up their internal machinery, pretty much forcing them to take a break. This slowdown is exactly what the construction crew needs to catch up, rebuild, and ultimately make your bones denser and stronger.
And because it's so targeted, Alendronate is a go-to for treating osteoporosis in both postmenopausal women and in men. It's also used to fight bone loss caused by long-term steroid use. And it treats a condition called Paget's disease, which is where that whole bone remodeling process just goes completely haywire. Okay, I need you to listen up, because this next part is, without a doubt, the most important section of this whole explainer. When it comes to taking this medication, the instructions aren't just little suggestions. They are a set of high-stakes, absolutely non-negotiable rules.
And I'm not just being dramatic here. This comes straight from the official medical guidance. The drug is incredibly effective, but it's also incredibly finicky. Following these rules is the only way to make sure it actually works, and, just as important, to keep yourself safe from some really nasty side effects.
Okay, let's walk through them. Rule number 1, you take it the very first thing when you wake up. Rule 2, it has to be on a completely empty stomach. Rule 3, you take it with a full glass of plain water, and I mean only plain water. No coffee, no juice, not even mineral water. They can completely block the drug's absorption. Rule 4, and this one is huge, you must stay upright, sitting or standing, for at least 30 minutes. No lying down. This is to protect your esophagus. Rule 5, after you take it, you wait at least 30 minutes before you eat anything, drink anything else, or take any other medications. And finally, Rule 6, swallow the tablet whole. Don't chew it, don't suck on it. That can irritate your mouth and throat.
And let me tell you why these rules are so critical. If you break them, there are 2 massive consequences. First, if that pill gets stuck in your esophagus, it can cause serious damage, like ulcers. And second, if you take it with food or the wrong liquid, your body just can't absorb it. The medication becomes useless, and the whole treatment is basically a waste.
Okay, so like with any powerful medication, we have to talk about the risks. It's really important to go into this with your eyes wide open. So let's separate the more common, manageable side effects from the issues that are rare but much more serious.
You can really put the risks into 2 buckets. In the common bucket, you have things like heartburn, maybe some nausea, or muscle and joint pain. The good news is strictly following those 6 rules we just talked about usually minimizes these. Then you have the rare but serious bucket.
We've mentioned esophageal damage, but there's also a condition called osteonecrosis of the jaw, or ONJ, and a very specific type of thigh bone fracture that can happen after years of use. Now again, these are very rare, but you absolutely have to know about them and get medical help right away if you notice any warning signs.
So because of all this, the medication just isn't right for everybody. You shouldn't take it if you have certain problems with your esophagus, if you have severe kidney disease, or if you physically can't stay sitting or standing for that 30-minute window. Also, it's crucial that your doctor checks your blood calcium levels. If they're low, that has to be corrected before you can start therapy.
So if you start taking this, what's the long-term game plan? The good news is, it's not necessarily a life sentence. Taking Alendronate is usually part of a really carefully managed plan that involves a lot of monitoring.
Here's what a typical journey often looks like. At year 0, before you start, a dental checkup is usually a good idea to lower that ONJ risk. Then, for the first couple of years, you'll be monitored with bone density scans to see how you're responding. Then, somewhere around the 3 to 5 year mark, your doctor will reevaluate everything. They might suggest what's called a drug holiday, basically a planned break from the medication. This is possible because the drug's benefits actually stick around in your bones for a long time, and taking a pause might help lower the risk of those rare long-term side effects.
And just one last practical tidbit for you. While there are daily doses out there, almost everyone taking this for osteoporosis gets the 70 milligram tablet, which you only have to take once a week. They made that switch a while back just to make it way easier for people to stick with that very strict routine. So, if there's one thing you take away from all of this, let it be this. Alendronate is a hugely effective medication. It can seriously strengthen your bones and prevent devastating fractures. But its power is only unlocked through a partnership between this powerful drug and a patient who is absolutely committed to following those rules.
And that really leaves us with the final thought here. A powerful drug demands a powerful commitment. Hopefully, what we've talked about today gives you the tools you need to have a really productive conversation with your doctor to figure out if this medication and the commitment it requires is the right choice for you.